again, there we go. We will turn it over to Dr. Cantor, who will walk you through the bulk of the process and the decision and what it means for Louisiana. And then we'll turn it over to Dr. Chatters, and then Dr. Van Cherry will be able to share their thoughts and insights as well. And so with that, I will turn it over to Dr. Cantor.
Thanks so much, Ali and Kevin. Thanks for everyone for joining. It's good to see some folks. And special thanks to Dr. Rachel Chatters, current president of Louisiana chapter of the American Academy of Pediatrics, and Dr. Van Cherry, who is the immediate past president of the Academy of Pediatrics. Dr. Chatters is from the Lake Charles area. Dr. Van Cherry is from the Shreveport area. Both have obviously been hard hit, as we all have with COVID. So very happy to hear and looking forward to hearing their perspective as well. I'll go pretty quickly because I know we have some time constraints here. What I'd like to do is give a little recap and show a couple slides from the CDC Advisory Committee meeting yesterday. And then after that, I'll talk a little bit about logistics of what happens now, what families can expect. And then I'll hand it over to Dr. Chatters, and then she will hand it over to Dr. Van Cherry. Quick recap on the timeline here. So two main things had to happen to get to where we are in terms of the approval or the authorization. The FDA has an advisory committee called VRBPAC, the Vaccines and Related Biological Product Advisory Committee. That's an independent group of experts that advises the FDA. They met last week. They rendered a recommendation to the FDA that the Pfizer vaccine should be authorized, receive emergency use authorization for individuals between the ages of 5 and 11. That was a non-binding recommendation that they made to the FDA. The FDA last Friday formally accepted that recommendation and formally extended emergency use authorization to this age group, 5 to 11. Yesterday, a separate independent advisory committee, the ACIP, the Advisory Committee on Immunization Practices, met to go over data, and they made a formal recommendation to the CDC that the CDC formally recommend this vaccine in that age group. And last night, CDC Director Dr. Walensky formally accepted that recommendation. And now it is the formal and official recommendation of the CDC that individuals between the ages of 5 and 11 do get vaccinated with this vaccine against COVID-19. So both of those two things, the FDA's authorization and the CDC's formal recommendation, had to and now they have happened. What I'm going to do quickly, and I'm going to share my screen as I'm talking, is I pulled just a few slides from the CDC Advisory Committee's briefing yesterday that I think just kind of cover the real basics of what they got at. I'm going to go through these slides relatively quickly just to kind of give the high points of where the advisory committee was coming from and their general recommendations to the CDC on this. I'll then take it off, share a screen, I'll talk about logistics, and then I'll hand it off to Dr. Chatters after that. So, one of the misconceptions, there's many misconceptions of COVID. One of the misconceptions that unfortunately became prevalent early on is that kids are not affected. And that's just really far from the truth. It's 100% true that older individuals are more affected. There's no question in that. But to say that kids aren't affected is a gross misrepresentation of the data. And now we have 19 or so months of experience. 1.9 million cases of COVID in kids aged 5 to 11 nationally. They account for 8,300 hospitalizations. In Louisiana, we've had a little bit over 1,000 hospitalizations of kids below the age of 18 of COVID. We've had about 53,000 hospitalizations total for everyone. Over 2,000 cases of multisystem inflammatory syndrome in children. This is a very severe complication of COVID. In Louisiana, we've had 272 cases of MIS-C, of which 2 of those kids are still in the ICU, and we hope that they do okay. There's been 94 deaths nationally of COVID in kids aged 5 to 11. That's certainly not insignificant. In Louisiana, we've had 3 deaths in that age group. We've had 18 deaths for everyone below the age of 18. 9 of those 18 deaths happened during this last Delta surge, which we've just now recovered from. And of course, the burden extends way beyond those case counts. Really, you think about all the interruptions in school, in children's and families' lives, school interruption, all the disruptions that families had to face, and it's difficult to quantify that. Over this past year, death from COVID-19 is now the 8th most common cause of death in children aged 5 to 11, tied with suicide. And that's between the dates of last October and this October. You'll note during that time frame, they counted 66 COVID deaths in this age group because they sliced it in just those months there. There's those 12 months. So certainly not insignificant by any means. We still see rather stark racial inequities in who gets sick and who bears the brunt of this pandemic that plays out, of course, in the younger age groups as well. So if you look at the rate of hospitalizations by race and ethnicity in this younger age group, you still see those stark inequities. So white Americans that are between the ages of 5 and 11 have been hospitalized for COVID at a rate of around 20 per 100,000 across the country. Black Americans of this age group, it's more than double. It's about 55, similar number for Hispanics. Stark inequities that also play into the need to extend the vaccine to this younger age group. And this is, I think, probably one of my favorite slides that the CDC went over yesterday. And it compares the impact in terms of deaths that COVID has had in this younger age group with the impact that other viruses have had prior to those viruses getting vaccines and those vaccines being widely adopted throughout the country. Again, there's no question, there's been many, many more older individuals who have died from COVID. That said, the number of individuals who have died in this younger age group is certainly not insignificant. And if you look at this chart for hepatitis A, before we had a vaccine between the years of 1990 and 1995, there was an average of 3 deaths a year in individuals younger than 20. For meningococcal, this is one of the bacteria that causes one of the more severe forms of meningitis. Before we had a vaccine against this type of meningitis, between the ages of 11 and 18, we had an average of 8 deaths per year. Varicella, this is the virus that causes chickenpox, shingles, an average of 16 pediatric deaths. Rubella, this is typically given as part of the MMR, measles, mumps, and rubella vaccine series, an average of 17 deaths. Rotavirus, respiratory virus, an average of 20 deaths. And in COVID-19, during a 12-month time period, an average of 66 deaths. So if you look at the viruses that have been problematic enough to lead to widespread vaccine adoption, COVID is almost about 3 times as deadly just in this past year alone. It does affect kids. The notion that it doesn't affect kids in any substantial way really has been disproven at this point in time. We'll talk about this particular vaccine. So it's a separate bottle. It's a separate product from the adult product, and they labeled it separately because the dose is different, and they didn't want any vaccine providers to get confused and give the wrong dose by accident. So it's a 10 microgram dose of mRNA product. That's a third the size of the adult and adolescent dose. Like the adult and adolescent dose, it's given in a 2-dose series, 21 days apart. The evidence primarily was based on a trial of about 3,100 vaccine recipients in this age group, but they also extrapolated to the experience of older kids. By this point, there's been 247 million doses of Pfizer vaccine given in over 12 years old. They extrapolated that data, and they also looked in the experience of fully licensed administration sets in people who are older than 16. They take a lot of point to show out the differences between this new bottle for individuals 5 and 11 years old and the older or current formulation, which is for adolescents and adults. I'll run through just a few of the key differences here. The dose is about a third the strength of the current or adolescent or adult dose, which means it's a smaller injection volume, less fluid goes in when you give the administration. It still is given as a shot, preferably in the deltoid or the upper arm, lower shoulder. There's now vaccine providers are going to be able to draw 10 doses out of a bottle as opposed to the 6 that they currently get with adults and adolescents. The storage parameters are also different. You remember Pfizer is the one that requires ultra cold storage, -80 degrees Celsius. It's a burden. Excuse me, at -80 degrees. It's a burden on vaccine providers. They were able to alleviate that a little bit. So this product will be able to be stored in 2 to 8 degrees Celsius, which is normal refrigerator temperatures. That's 36 to 46 degrees Fahrenheit, be able to be stored in a regular refrigerator for 10 weeks. The reason why that's important is we expect more smaller clinics to be receiving this vaccine. Families are typically comfortable receiving their pediatric vaccinations in pediatricians' offices or wherever that child receives their medical care. We want to be able to equip those offices with vaccines so they can give it to their patients and their families. And so being able to keep this product in a regular refrigerator for 10 weeks is an added benefit. It makes it easier to use. I want to compare quickly the side effect profile in this younger age group with older kids. And what we're going to look at here is the top line, which is the study participants that actually received the vaccine itself as opposed to the placebo. And we're going to run through the systemic side effects that we're seeing here. And you'll note in each of these categories, we're comparing the 5 to less than 12-year-old age group with the 16 through 25-year-old age group. The 5 to 12-year-olds got the 10 microgram dose and the 16 to 25-year-olds got the higher dose, the 30 microgram dose. In each of these categories, fever, fatigue, headache, chills, vomiting, diarrhea, muscle pain, and joint pain, a fewer percentage of the younger individuals experience those side effects as compared to the older individuals. It's what we would expect. Kids typically tolerate vaccines fairly well, and it's a much smaller dose. So the expectations are that the side effects will be less in the younger kids who do get the vaccine as compared to adolescents and adults. I have to take a minute and talk about how the safety will be monitored as we extend this to younger individuals. And it really is not an exaggeration to say there is the most robust monitoring system in place right now that this country has really ever seen. And it's quite impressive. There's 4 components to it. The V-Safe component is a self-administered questionnaire that people can sign up for, and the CDC will text them a questionnaire at regular intervals after receiving the vaccine. That's a brand new thing that has been made for COVID specifically. And it's a way to directly hear feedback from patients and families themselves. VAERS is the Vaccine Adverse Event Reporting System. We've heard a lot about this. I'm going to talk a little bit about it in a second. VSD is the Vaccine Safety Data Link. This is a network of 9 large healthcare institutions throughout the country where the CDC gets very granular data of patient records and can track vaccine side effects and efficacy that way. It accounts for about 12 million patients a year. So it's a very big data set that the CDC is able to plug directly into and get very detailed information. And the CISA product, the Clinical Immunization Safety Assessment Project, is a network of 7 research and medical centers throughout the country that give technical expertise and help review cases. So when when a possible adverse event is reported, that case will either be investigated by the CDC itself and or by one of these medical research partners. And the reason why that's important is because they're independent. They don't work for the government. And so there really is an element of transparency in this, and there's an independent review of these cases. I'll talk a little bit more about the VAERS platform because there are a ton of misconceptions about this. And because it's so transparent, it's been really easy for people to misconstrue what it is. VAERS is a early warning system for potential adverse events. And the idea of it is the CDC wants to cast a very wide net. And any potential event that could be related to a vaccine, they want to know about so that they can go investigate that, which means that the majority of cases that get reported to are going to end up having determined that they're not actually related to the vaccine, but they all go into VAERS because we want to cast a very, very wide net early on so that nothing at all gets missed. So the strengths of this platform are that it's very quick. It can rapidly detect potential safety problems, and it can detect very rare events because it's pretty precise in what gets reported to it. It does have a lot of limitations. It's passive, which means people have to proactively report to it. You can report to it as a patient, as a family, or as a physician or a provider. Its quality is inconsistent and incomplete. The report really is only what people choose to put into it. It has a lot of bias in the reporting. And the biggest limitation is that it cannot cause or determine cause and effect. So every case that gets put into this gets examined or investigated in one form or another. The entire VAERS database in a de-identified way is public, it's transparent. So you can go on and see all the cases that have been reported. It doesn't mean that all those cases are actually caused by the vaccine themselves. They've just been reported and they need to be investigated. There's one story that I really like to share that happened a couple of years ago. A physician was trying to make a point, to make this exact point, that the VAERS database is a first step to lead to investigation. It doesn't mean that something caused something. He self-reported an adverse event of himself. He reported that a particular vaccine caused him to turn into the Hulk. His skin turned green, his muscles swelled. He entered this into VAERS, and it was public. People could go in and see this. He just wanted to make a point that anyone can put anything into VAERS. All it means is that it then gets investigated. The CDC actually had to contact him and ask him nicely to remove that report from VAERS so it wouldn't cause confusion. The CDC does not remove anything from VAERS. So it shouldn't be confused with causation. We hear a lot of that confusion. I think it's pretty easy to go into VAERS, pull a bunch of data and say the vaccine's causing this and this and this. That's not true. All those cases get investigated, and then some of them are counted as adverse events. Some of them, usually most of them, have other causes that get found. They spent some time in the CDC reviewing the risk-benefit calculations for extending the vaccine to the 5 to 11-year-old age group. And I'll run through quickly kind of the crux of what they came to. And I'll point out they did this calculation twice. They did it once using recent data, particularly a week in the middle of September. They did it again using data cumulative from the entire pandemic. And the reason they did that is this, in September, most of the country was either in the beginning of a surge or at some point in their surge. We were coming down from the peak of our surge. So the numbers were higher. So the benefit of a vaccine would be higher still. So they did it both ways. They did it that way to show likely the maximum benefit, what it does during a surge. And then they did it again to show cumulative data so that it didn't get skewed with the higher numbers during the surge. During the surge, and I'll just go off of the Mayo line, they're very similar. They calculated for every million Pfizer vaccinations in this age group, about 57,000 cases of COVID would be prevented, over 200 hospitalizations would be prevented, 130 cases of multisystem inflammatory syndrome in children would be prevented, and 72 ICU admissions would be prevented. Again, they did that during the cumulative data too, so that they weren't skewed by this, by the higher numbers in the surge. That's what's shown on the right-hand side of this graph. And even without looking at surge numbers, which might inflate the benefits here, the numbers are still pretty substantial. 18,500 cases prevented, 80 hospitalizations prevented, 42 cases of MIS-C prevented, and 26 ICU admissions prevented. They went into the risk a little bit. One of the points here is that the rate of myocarditis, which is one of the more feared but very rare complications with the mRNA vaccines, is unknown in this age group, but believed to be less than it is in the other age groups. In the adolescent and young adult age group, it's about 10 cases per million. But we do know most forms of myocarditis go down in prevalence when you get to this age group. So the expectation is that there'll be less cases of myocarditis per vaccination rate than there are in the adolescent and young adult age groups. And again, with a third of the dose being administered here, the expectation is that side effects and the adverse events will be less as well. And the last thing I'll close on here is this is a snapshot from August, so a little bit out of date, of where families are at in terms of intending to have their younger children get vaccinated. I'll point out here for the 5 to 10-year-old age group, parents, and this is a national snapshot that's also 2 months out of date. About 46% of parents of those aged kids plan to get their children vaccinated, with an additional 14% that are still unsure. When you go up to the 11 to 18-year-old age bracket, it's 55% plan to get their kids vaccinated, with an additional 11% that are unsure. And the other point to make on this slide, if you look at those numbers by race and ethnicity, is we still have our work to cut out for us, particularly in the Black community, where those rates are lower than every other race and ethnicity. We know that marginalized communities have borne the brunt of this pandemic. They have the most to benefit from a vaccine like this. And I'm just flagging that we all have our work cut out for us to message the data and communicate with marginalized communities in a way that's respectful and effective. I'm going to stop my screen share there and just hit on a couple high points of what happens next in terms of this vaccine rollout. Vaccine is being shipped to vaccine providers right now. There are total right now about 450 vaccine providers who have signed up to receive the 5 to 11-year-old vaccine. That number will grow. And these initial shipments are going in 3 distinct waves. The first wave, the first 2 waves will give just over 100,000 doses. What I have to say is that's being shipped right now. Some of these providers have already received the shipments. Many haven't received them yet. Many will receive them tomorrow and the next day. So the message to families is call ahead to your vaccine provider, whether it's a pharmacy or a clinic, make sure they have it in stock. They all should have them in stock by the end of next week, but some are literally still in the mail right now. The best place to go right now to find out where the vaccine providers are is either 211 or the vaccine hotline, which Ali can put in the text, but it's 855-453-0774. By the end of this week, 5 to 11-year-old vaccines will be added to vaccine.gov, which will probably be an easier place for people to go to search. I'm going to pause there. I'm going to turn it over to Dr. Chatters. She'll then turn it over to Dr. Vancheri, and then we'll come back and take any questions that remain. Dr. Chatters?
Hello, yes, I'm sorry, I'm actually on the move today, so I'm in my car, but I would like to say that as president of the Louisiana Academy of Pediatrics, I just want to say that this is a celebratory day for us, or a time period, because we have been wanting to engage our 5 to 11-year-olds in the best way we can to get them back to a normal process in their daily family lives, their community lives, their educational lives, in being able to just be quote unquote normal. And one of the processes for that is to get them the best protection possible. And for us at this time, that is immunization. And I just want to emphasize that at this very time, one of the things that we want to get across is that it is flu season, and it is, of course, COVID season. So we need to be immunizing for both for our children. And our children who are 5 to 11 can engage in this process now, and we are excited for it. And we would like to emphasize the data as you present it, and the facts, the science, and to work with that process, and to try to work against the myths and misconceptions and misconceived motives for this regarding the virus, and just try to not diminish people's fears, but to address them. And I know that Dr. Vancheri and I have to leave quickly, so I'm going to let him give a statement as well, and go forward from here.
Thank you, Dr. Chatters. Dr. Vancheri?
Great. Thank you, Dr. Chatters and Dr. Cantor. I think, as Dr. Chatters said, this is a great day for our kids, because now we add another tool in our toolbox of mitigation strategies to reduce the impact and the future impact of COVID-19 in one of the largest unvaccinated populations we still have. The 5 to 11-year-olds nationwide account for about 28 million children, and to get those kids vaccinated within the next few months is one of the keys to preventing the next surge. When we started vaccinating last January, we talked about the importance of vaccinating elderly and as many adults as we could quickly to prevent the next surge. We got to a good spot in the spring, masks were off, and boom, the Delta variant came in and really wreaked havoc through the summer on our system, on our state. And that is the kind of havoc that we don't want to see again. Part of doing that is continuing to vaccinate adults, especially young adults, because they are the super spreaders in this pandemic. We have done I think a fairly good job now. Over a third of teenagers statewide are vaccinated or have begun their vaccine series against COVID. And now the 5 to 11-year-olds are eligible for vaccine and represent, again, a real important school age group to vaccinate so that we can prevent the next surge from coming. But it takes everybody participating. And as Dr. Chatter says, that this, there's nothing nefarious in this vaccine or its development. As an investigator of the vaccine for the Pfizer vaccine protocol at our site here in Shreveport, we've enrolled over 400 individuals in the vaccine trials, 75 of whom were in this 5 to 11-year-old age range. These are kids who came in excited about participating in this cutting edge research and being really pioneers in getting the vaccine, because they recognize how important it is to help their friends and protect their community. And our teenagers have also shown that their interest is very high in getting vaccinated and protection for their friends and loved ones. So as an investigator, I will emphasize what I've said before. No corners were cut in the safety evaluation or the production of the COVID-19 vaccines. What was reduced was the bureaucratic burden so that we could respond to this pandemic as rapidly and efficiently as we could, but always maintaining the highest safety standards for adults and for children. Now we're more than 14 months of use of the vaccines, beginning in the clinical trials last summer 2020. And I, as a physician, but more importantly, as a parent, have very high confidence in the vaccine that we are providing for kids and adults to prevent COVID-19. The efficacy here in the 5 to 11-year-old age range is better than 90%. So we're talking about more efficacious than masks. We know that, and we expect there will be some breakthrough infections in the future. That's not a surprise. 90% protection means 10% not fully protected. So we can't emphasize enough the importance of being calm, think through the process, understand that what this is about is protecting our children and keeping them in school where they can learn best. Nobody wants to go back to homeschool, virtual school, all of those things. And many parts of the country still, kids have not gotten back to full school. But in Louisiana, we've done better, and we will continue to do better. And this vaccine is a key tool toward that. So I'll stop there and happy to answer any questions before I have to cut out.
Thanks so much, Dr. Vancheri. I am not the pediatrician. Dr. Chatters and Dr. Vancheri are, and very committed ones, and they represent the academy here. So I think their word carries a lot. It certainly does with me. I went pretty quickly during my presentation because we're trying to get it in under time. So I think we have a little bit more time to answer questions now. Dr. Chatters and Dr. Vancheri will stick around as long as they can. At some point, I think they're going to have to bug out. I'll stick around longer than that and be happy to answer any questions. Kevin, let me turn it over to you to moderate us through Q&A.
Yeah, I think the one question that I saw that maybe Dr. Vancheri and Chatters might be able to address before they go is what kind of misinformation are we seeing that's specific to the dose for the kids? Parents have some hesitancy there. Have we seen any polling data around that for parents in Louisiana?
Yeah, I'm still getting a lot of questions about effect on fertility. And the first important point there is that no vaccine has ever affected fertility. period. And there's no biologic plausibility or reason to believe that this one is any different in that respect. And number two, that, we over 130,000 pregnant women have received this vaccine. Many thousands of women and men in the preconception phase trying to become pregnant have received the vaccine, and it has not affected their fertility. On contrast, we know 135,000 pregnant women have gotten COVID, and over 20,000 of them have ended up in the hospital, and nearly 200 deaths of pregnant women. And so the confidence here is look at the data. No impact on fertility has been seen anywhere.
Thanks. This one has to do with the distribution. We have a couple of questions on distribution, actually. Vania Joseph from WVLA says that they called some pharmacies, and those pharmacies said they weren't too sure when they were going to get shipments. And Melinda was wondering about how much the state's getting on this first order, how many we've received, how are they being distributed?
Yeah, great question. So on the first two waves of ordering, we're getting 113,400 doses. To put that in perspective, there's about 420,000 kids between the ages of 5 and 11 in the state of Louisiana. The shipments are going to be slow going for the next 2 or 3 days. So there's a handful of vaccine providers who have already received their doses and are administering the vaccine right now. The balance will get their shipments either later this week or early next week. By the end of next week, we've been assured from the feds that all these first wave shipments will have been sent out. So what I have to ask families is, for these first few days while shipments are rolling in, just be patient with your vaccine provider. Their shipment might be in the mail, or they might be unpacking it, going through the process. By the end of next week, we should be at steady state, and all these vaccine providers will have theirs in stock. Until that point, it's going to be, I think, a little bit slow going as clinics receive their shipments from the feds. Any vaccine provider can become a 5 to 11 vaccine provider. We encourage them all to do that. Like I said, we have 457 current vaccine providers will be receiving these first wave shipments, and about 80% of our vaccine for children clinics will be receiving them as well. We do expect families to be more comfortable having their younger kids get vaccinated in their pediatricians' offices. And many of those pediatrician offices are already vaccine providers. For the ones that are not, we're reaching out to them now and encouraging them to do so.
Great. Vania had a follow-up on your numbers that you talked about with the deaths nationally. I think you cited a number that said 94 children had died of COVID-19 nationally. We had 18 over the course of the whole pandemic, which would make it seem like Louisiana stands out as having a high number of deaths. Are those numbers that you cited, do those cover the full pandemic? Can you just talk about where we are nationally?
Yeah, the 94 number is children aged 5 to 11 who have died nationally. We have had 3 children aged 5 to 11 who have died in Louisiana. We've had 18 children below the age of 18 who have died, 9 of which died in this past Delta surge. And that's except for the last surge, those numbers are throughout the entirety of the pandemic.
And the children that died that were 5 to 11, there were some during that, during the Delta surge. Is that right?
Yeah, that's right.
I think that covers most of the questions. There was one question about just the types of providers that will have them. It's mostly pharmacies. They asked about hospitals. I know you talked about doctors' offices will have them. Did you want to expand at all on the types of providers that parents can look towards?
Yeah, I mean, it really is the same group of providers that have been vaccine providers throughout, clinics, pharmacies, hospitals, and then some stand-up clinics, some special events, some neighborhood-based events. Any and all of those are eligible to be a pediatric vaccine provider. And of the 450 or so that are going to receive these first 2 wave shipments, it covers the gambit of all of those types. So, the only caveat here is we expect that families are going to particularly seek out the smaller clinics, the pediatrician's offices, to get this vaccine. So there's an extra push put the vaccine into those locations. But in general, the same places that people got vaccinated earlier, pharmacies, both independent and chains, hospitals, smaller clinics, and these freestanding events, and the events run by the National Guard will have the vaccine and be able to vaccinate 5 to 11-year-olds once they get it in stock. And some of them have it in stock already. Some of them don't have it in stock. And just to mention one other thing, I see Emily asked the difference in the total vaccine numbers that have been said. There's 3, I should have been a little more clear in my language, Emily. There's 3 waves of this initial shipment. By the end of next week, we think all 3 waves will be in. 113,000 is the total for the first 2 waves. 148,000 is the total for all 3 waves together of what we're getting in this first round.
Great. Well, that's all I'm seeing for questions, but I will just say that we will get this video up for you by the close of business. If you need to use the recording for television, that's just fine. And if you didn't get a question answered and you'd like to follow up, I'm happy to field that for you. Just send me an email and we'll get all your questions answered. Thanks everybody for joining. We really appreciate your patience on this and your interest. Stay in touch as the rollout for these vaccines goes forward. We're going to be doing a lot more in terms of proactive outreach. So we appreciate your partnerships and thanks so much for joining.